My professional opinion is that we need to stop fooling around and stop with the stigma and start normalizing the chronic medical disease that is opioid use disorder, just like we've normalized the chronic medical diseases of hypertension and diabetes. So I'll try not to get too agitated or passionate. I know I'm in good company on this panel, but really the whole thing is ridiculous. We put so much effort into treating chronic medical disease in the United States of America. We have lots of fancy drugs to treat all sorts of medical problems. When someone gets diagnosed with diabetes, they're typically offered some kind of counseling regarding changes in their nutrition and their lifestyle. So what we're doing with every other chronic medical disease, all we're asking is that people get on board to treat opioid use disorder or alcohol use disorder or any substance use disorder the same way we treat the stuff that we all have. Everybody here and everybody in the community knows someone who has unfortunately died from opioid overdose or has struggled with opioid use. So no longer are we dealing with an abnormal situation where we should be worried about stigma, or where we see stigma might be, it's never appropriate, but see where, oh gosh, it's appropriate, people are afraid, it's as abnormal. It is normal. And the more we normalize it, the more we talk about it as a community, that's how the stigma will get broken down. And the same goes for physicians. And of course, I know Dr. Joseph agrees. When we talk as clinicians to each other, it's normal. This is what we're dealing. It's another medical disease that we're managing. So it is one substance for another. But that's what we do all day, every day in medicine. You don't make any more insulin, I'm going to give you some insulin. You seem to have an imbalance in the way your body manages salt and you have high blood pressure. Let me give you the substance that you need so your body can take care of the salt. So it's so funny and just wildly ridiculous that we won't allow patients with opioid use disorder to switch around the substances when this is what we literally do every single day. So it's not a belief system whether or not we should use methadone instead of heroin or fentanyl, or buprenorphine instead of heroin or fentanyl. It's not a belief system, it's science. And if anybody takes a medication every day for chronic disease, or anybody takes a vitamin because their doctor said it was good for them, that's the science that we need to also put on to use disorder.